Good evening, all my NEET PG aspirants. How is your preparation? This is Dr. Bharadwaj, who is your roommate, classmate, benchmate, tablemate for you to become the NEET PG topper. Please don't forget to download the Incus app just for rupees 999 only, 3-year subscription for the NEET PG preparation, the cheapest in the world. 2000 HD videos, 60 full scale granted, 70,000 MCQ question bank, 3,500 quiz tournaments, 70,000 MCQs as the revision flashcards, and 1 lakh PowerPoint slides notes. Oh my God, nobody will give for just 999 rupees. And only Dr. Bharadwaj is insanely affectionate to all of you to make your preparation as cheap as just 1 rupee per day. 1 rupee per day. So let's make the great beginning. What are those 30-40 points that I can revise for all you as your classmate for the tomorrow's exam? Octreotide. Lot of times this question is asked. Octreotide is a long-acting somatostatin analog. Secretory diarrhea. For example, carcinoid syndrome, lipoma, there we use the octreotide. Similarly, after you do vagotomy, there is a development of diarrhea for the treatment of that. Similarly, short bowel syndrome, AIDS also, there will be certain infections that lead to secretory diarrhea. And also for acute pancreatitis, for treatment and prophylaxis, we use the octreotide. Acromegaly management also we use octreotide. Islet cell tumors which are producing excessive insulin, to antagonize that, we use the octreotide. And for controlling the acute bleeding due to the esophageal varices, we use the octreotide, one of the favorite questions of the examiner. Now, you have a patient paraded to you, thyroid storm. The patient is in a comatose state. How are you going to manage thyroid storm? What are the principles of management of thyroid storm? Is one of the most favorite questions of the examiner. Propranolol. Why? Because all that excess thyroxine is leading to tachycardia, CHF, cardiovascular manifestations. So, in order to count all that hyperthyroidism, cardiovascular manifestations, we use propranolol. So, if the patient is asthmatic, beta blockers are contraindicated. Then, in the thyroid storm, to bring down the cardiovascular manifestations, we use calcium channel blockers like diltiazem. We use iodides. Sodium iodide, potassium iodide, Lugol's iodine, basically to inhibit the release of the thyroid hormones. Propylthiazole, methimazole, they decrease the synthesis of thyroid hormones. Hydrocortisone, wonderful drug, commonly used by the brand name F-Corlin, right? So, hydrocortisone to protect against the shock. Always a very important principle. A thyrotoxic storm patient is febrile. So don't get tempted to give aspirin. Aspirin should be avoided because it can displace the T4 from the thyroid binding globulin, and that can further worsen the elevated levels of free T4. So aspirin is avoided. Aspirin is contraindicated in thyroid storm. This is the favorite MCQ of the examiner. Tomorrow's NEET PG, you will remember Dr. Bharadwaj. Now, tell me 5 points about metformin, doctor. Metformin hota hai biguanide. Unlike sulfonylureas that increase the release of the insulin, if you take sulfonylureas, typically the sulfonylureas are called insulin secretagogues. But metformin is not a secretagogue. Then how does it bring down the blood sugar? It inhibits the gluconeogenesis and glycogenolysis. And how does it do? It stimulates glycolysis and glycogenesis of the glucose. It also decreases the absorption of the glucose from the intestine. Whatever the sugar eaten by the patient, it is prevented from getting absorbed from the intestine by the metformin. That's the reason sometimes people who use metformin will end up with diarrhea. So metformin is called euglycemic. Euglycemic is what you need to remember. So there is no risk of any hypoglycemia if you are using metformin. But what are the major side effects of metformin, doctor? Lactic acidosis, megaloblastic anemia, especially if the patient is having a hepatic failure, renal failure, or chronic alcoholic. In them, if you happen to use metformin, on one side metformin is preventing gluconeogenesis and glycogenolysis. So that is the reason they end up with lactic acidosis. Is a prospective complication, potential complication of metformin. Not in everybody, in the people who have hepatic failure, the renal insufficiency, or in those who are chronic alcoholics. That is the fatafat news you need to know about metformin. Abhi aa gaya insulin. Once more, I want to tell all of you, doctor, please download Incus app. In pharmacology, both theory and MCQ based discussion, गर्मा गर्म हमने डिस्कस करके वीडियोस लगाया. Insulin, types of insulin, differences, what is called peakless insulin, everything about insulin in the Incus app. So please download the Incus app and do the revision. So what you are seeing here is the insulin Lispro. Insulin Lispro. So what is insulin Lispro? इसका कहानी क्या है? Lispro insulin is an insulin analog produced by the recombinant technology. So what is the onset of action? It is very rapid. Within 15 minutes of subcutaneous injection, it starts working. It peaks in 30 to 90 minutes and it lasts only 3 to 4 hours. That is the reason if you are giving Lispro insulin to any patient, you should tell them that it should be taken 15 to 20 minutes. Meal should be taken 15 to 20 minutes after the Lispro injection. Whereas regular insulin, what is your advice? The patient can wait for about 60 minutes after taking insulin, no problem. But yahan to 15 to 20 minutes. And the patient should be told take adequate carbohydrate diet early in the meal so that you can avoid hypoglycemia during the meal. Even while eating also patient can go into hypoglycemia. So he must be told, please add some carbohydrate in the early part of the meal if you are taking Lispro. And the duration of the action is about 4 hours, irrespective of dosage. That is important. Whereas, what is the main difference between regular insulin and Lispro? Regular insulin, larger the dose, longer the duration. Larger the dose, longer the duration. That is the story of regular insulin. Whereas here, Lispro, whatever be the dosage, Lispro, whatever be the dosage, irrespective of the dosage, duration remains 4 hours. These are 4 or 5 points like a parrot you should remember and rattle out in the tomorrow's exam. Now the next favorite question. In which subset of patients you want to use oral contraceptives very carefully? Liver disease, migraine, optic neuritis, asthma, diabetes, retrobulbar neuritis, eczema, hypertension, convulsive disorders, OCPs, tasma, jagrata. You need to be careful. Now, tamoxifen is a favorite question of the examiner, doctor. Tamoxifen is a selective estrogen receptor modulator. Selective estrogen receptor modulator का मतलब क्या होता है? In the breast, it acts like an estrogen antagonist. It decreases the risk of contralateral breast cancer. It is also used for primary prevention of the breast cancer in the woman. So some places it acts like antagonist, some places it acts like a agonist. If you take endometrium, in endometrium, tamoxifen acts like a estrogen receptor agonist, not antagonist. That is the point you need to remember. So, because of its antagonistic action on estrogen, hot flashes, then vaginal discharge or bleeding, menstrual irregularities, there can be hepatotoxicity, rarely thromboembolism, endometrial hyperplasia, tumor flare, cataract. These are the adverse effects of tamoxifen that you need to basically remember. अभी आ गया जब मेडिसिन में बट्टी मारने वाला items. So don't forget, doctor, tell all your friends, every medical student should have Incus app. Because it is just 999 rupees only with almost 2000 HD videos. Every day new videos are updated. New videos. To teach is our inborn error of metabolism. Without teaching at least 1 घंटा हमको नींद नहीं आता, हम क्या करेंगे? हमारे साथ there are about 500 recent NEET PG toppers who want to start a career in teaching. And also they are passionate to help the medical students worldwide. And they all signed up with us to provide many new videos. Whatever variety you want, they become available with different teachers. So please download Incus app. So, Wernicke-Korsakoff syndrome. What is the favorite MCQ? Whether you go to USMLE, INICET, FMGE, NEET PG, whichever the exam. Mammillary bodies, medial part of thalamus and mammillary bodies of the hypothalamus, Wernicke-Korsakoff syndrome. So you know there is a thalamic nuclei, then here you have the mammillary bodies. So all these structures, right? So our emotions, limbic system is also very close. So, subthalamic nucleus of the basal ganglia, hemibalismus, patient will be waving his hands like the wings of the bird, is what you need to remember. Similarly, caudate nucleus, Huntington's chorea, substantia nigra, what will you remember about substantia nigra? Parkinson's disease. Please don't forget this basal ganglia. Now, let's talk about amygdala. All emotions कहाँ होता है? Amygdala में. So amygdala. Amygdala, if it is affected, you get Kluver-Bucy, hypersexuality, hyperorality, hyperphagia, visual agnosia. They're all the things with amygdala. And any increased activation of amygdala, it can lead to depression. That is what we need to remember. Hippocampus. Hippocampus is important. You know, this strip is there, no doctor. This strip, इसको बोलते हैं hippocampus. Hippocampus को कुछ हो गया तो short-term memory impairment. When you are in third year MBBS, you forget about second year MBBS में who was your boyfriend. If hippocampus is affected. So, Alzheimer's disease, short-term memory impairment, hippocampus is pathology. Then lateral geniculate body, medial geniculate body. Remember, lateral geniculate body is associated with vision. And medial geniculate body is associated with audition. Where are our ears? Ears are lateral. Eyes are medial. But the medial eyes, vision is lateral geniculate body. Lateral ears, audition is medial geniculate body. That is the tension. Okay? Now you understood. Now red nucleus. Red nucleus. Midbrain के नजदीक में होता है red nucleus. So whenever red nucleus is affected, you get tremor. And this is a resting tremor and also intention tremor. Generally, whenever cerebellar lesions lead to development of the intention tremor during action, and whenever there is a Parkinsonism, basal ganglia, that is resting tremor. So both resting tremor, also intention tremor, दोनों कहाँ मिलेगा आपको? Red nucleus lesion में. So multiple sclerosis tremor is rubral tremor. Red nucleus के वजह से होता है multiple sclerosis का tremor. Then this area is called prefrontal area. Any damage to the prefrontal cortex that will lead to disinhibition. Person will lose all his clothes and running nakedly in the street. Problems with social interaction, judgment, even schizophrenics also problem in prefrontal cortex. In fact, left prefrontal cortex में जरा गड़बड़ हो गया तो डिप्रेशन आएगा. एमिगडाला में ज्यादा एक्टिवेशन हुआ तो भी डिप्रेशन आएगा. That is what you need to remember. So anterior hypothalamic nucleus, it is very important for thermoregulation and circadian rhythms. That is what you need to remember. So in my next video, I am going to revise you antesublatory, middle sublatory, posterior sublatory, Weber syndrome, pica, all these things in my next short video. So enjoy the preparation, doctor. Don't worry, will I remember in my exam or not? You'll remember all these things automatically, right? You have a wonderful brains in the world. So don't forget, please download Incus app. Rupees 999 only for 3 years. Only 1 rupee per day. Every medical student must have the Incus app. You don't need very costly coaching programs, 40,000, 50,000. That plan, this plan A, plan B, plan C, पूरा प्लान को सागर में छोड़ दो और आपको एक ही गंगा जल का जरूरत होगा, वो होता है Incus app. Please download. Thank you.